We're going to talk a little bit about pain management, and we kind of touched on it before, and it's becoming more of a problem today with regards to the monitoring that's going on. I mean, I have to go on the Pennsylvania website on every patient that I think about writing any kind of pain med that's any kind of class-related pain med, and look them up. I got to see what they've been taking. I got to get what their thing is. I got to register that I'm going to write the prescription and let them know. And then I have to make a decision as to what to give them. And it's a struggle trying to maintain pain management. Now, we have been very successful.